Hello everyone, welcome to our project Bryron. This is Arpita.
This is Harsha.
This is Ritvik.
Our approach to the problem is simply based on everyday observations. Like in my house, I have observed that my mom spends a significant amount of her free time in drying and ironing clothes. What if she falls sick, but you have to wear a nice suit for an important event? Unnecessary work for her, right? When she should be taking rest. Hence, we have chosen this problem to reduce workload of people and organizations. We are here to present to you our problem statement, that is an efficient way for simultaneous drying and pressing of clothes in the same product without any human intervention. So you might be thinking that what is the relevance of the problem in today's context? What if what is the needs to solve the problem and who are its affected stakeholders? Well, let's dig right into it. Based on our understanding of the problem, we were able to identify two potential customers. These are the common people and hospitals or medical centers. Firstly, for the common people, it might have occurred to us many times that we want to wear our favorite clothes to an event, but we cannot do so as they are still wet, perhaps due to continuous rains, or they are not pressed, damp, and too many wrinkles, or maybe both. Pressing and ironing is a laborious and time consuming activity. It cannot be employed for certain fabrics like velvet, spandex, muslin, etc., as it destroys them and requires a flat and hard surface to operate. If left unattended, the iron box can burn the cloth and harm the user. This is a socially relevant India specific problem. Secondly, for the hospitals, a reliable laundry service is of utmost importance to the hospital. In modern times, patients expect linen to be unchanged daily. An adequate supply of clean linen is essential for the comfort and safety of the patient. The operation theatre linen materials need special care since it has to be washed and sterilized carefully. By overcoming
In the first place, we have identified the common people like you and me, the different stakeholders involved in the consumer retail sector who would most likely use the product for domestic purposes include daily users within the household, dhobi, laundry services. Naturally, a question arises that what are the needs of these common people? Some of them are listed as follows: affordability, less weight, user friendly, appearance, less spacious, structure, warranty, less power consumption, quality of product, less time to wash, price per cloth should be less. The alterables which, when taken in the problem context, include stand with wheels, make in India, sign, symbol, digital display, cheaper material, adjustable size as per use, multiple power sources, better steam generation, cylindrical shape, faster spinning speed. Common people's perspective. For simultaneous drying and pressing, hereby providing a hassle-free experience. For people in hill stations, it helps them to wear warm clothes at almost all times. During winter and cold seasons, depending upon the urgency or emergency, warm and pressed clothes are made available in any instant. These factors represent the common person's point of view and signify how each of stakeholders, be it the household families, Toby, or laundry service, can tackle the problem comfortably and conveniently. Now we explore the other perspectives of common people. Historical perspective. The LPG fueled irons are eco-friendly and have no side effects compared to conventional coal-fired iron boxes. In the conventional variety, launderers inhale CO2 emitted by it for a prolonged duration, resulting in respiratory problems such as lung cancer, TB, and pneumonia. When the gas meets a source of ignition, it can burn or explode. Cylinders can explode it if involved in a fire. Psychological perspective. As there is less workload for people in drying clothes, it gives them more freedom to do other things. Users will tend to become lazy as the machine does all the work. Sociological perspective. Since it is a technological replacement for Dhobi, he or she may be outcompeted in the market by the machine. Environmental perspective. Water is conservative as reusing of water to produce steam takes place. Economic perspective. Dhobi seeks to increase his margin of profit while trying to limit his effort. He does this so that he can make money and attract customers at the same time. Now there are two scenarios: before buying product and after buying product. Case 1, let's say Dhobi charges 20 rupees while The actual cost price is 10 rupees without the product. Thus, here he makes a profit of 10 rupees. Case 2, let's say the Dhobi charges 20 rupees while the actual cost price is 6 rupees with the product. Thus, here he makes a profit of 14 rupees.
We now arrive at perhaps the most important application of the problem statement, that is, in hospitals and medical centers. The affected stakeholders in this sector include doctors, nurses, patients, and the housekeeping staff. Hospitals, being such big and resourceful institutions where lives are literally on the line, have the need to resolve the problem so that their following needs can be satisfied: space for heavy equipments like washing machine and squeezers, provision for supply of water and power, space for sorting the soiled linen, facilities to automatically wash the doctor's gowns and clean other soiled linen, space in every ward for storing the clean linen. Hospital perspective. Hospitals need to provide fresh and warm napkins for newborn babies. Receiving blankets are those which are used to wrap a newborn baby, thus providing them warmth as soon as they come out of the womb. These are made to withstand heavy use and laundering and work for a variety of temperature conditions. Bed sheets or pillow linens for patients to rest on. Clean medical linens are important because they allow patients to feel more comfortable and at ease, vital simply from a sanitation perspective. They prevent the transmission of germs and provide for an aesthetic value, especially in a high stress environment such as a hospital. Operation theatre dress or gowns for doctors and patients, which are used in surgeries. Sterile surgical gowns are worn as a barrier to fluid and microbial transmission during surgery. In order to provide a safe germ barrier for patients and surgeons, gowns should have a high barrier effect as well as a good wearing comfort during the whole surgical procedure. In addition, surgical masks protect the medical and dental professionals from acquiring or transmitting infections. Compression bandages. Compression bandages such as grip bandage and wrist braces are used to apply pressure to a specific area or injury. They help minimize swelling by keeping fluids from gathering at the injury site. Cubicle curtains, which act as a barrier between multiple patients. In addition, there are various other perspectives as well, which are required for smooth and efficient functioning, such as the health perspective, in which quality and clinical standards can be maintained to obtain cleaner clothes; the psychological perspective, where the workload for the staff decreases in washing them, thus they can tend to more number of patients and possibly save more lives; the economical perspective, in which the following factors should be kept in mind: reasonable capital cost, availability of spare parts and ease of maintenance, efficiency in working under normal conditions, economy in consumption of utilities like water and power, continuity of workflow and reduction of manual labor. Sociological perspective. This site focuses mainly on employment. Since the machine does the work of multiple people at a time, it can be used continuously, thus replacing them and resulting in the loss of jobs. In a way, operational costs of the hospital decrease slightly.
Units. So, at the end, we would like to conclude our problem analysis on how it is affecting common people and hospitals. Today, healthcare facilities have strict guidelines for the cleaning and handling of linens and clothing, including the use of specialized detergents and disinfectants, and the use of protective gear for workers handling contaminated items. These practices are essential for preventing the spread of infectious diseases and ensuring the safety of patients and healthcare workers. The role of environmental cleaning is important because it reduces the number and amount of infectious agents that may be present and may also eliminate routes of transfer of microorganisms from one person or object to another, thereby reducing the risk of infection.